Okay, let's talk about your concerns regarding cancer. Most women have heard the reports of cancer risk, particularly breast cancer, and I know you have had friends or relatives who have been faced with this, and you wonder every time you go to the doctor for a checkup if you could be affected. I've been prescribing hormones in both men and women for nearly 35 years, and I have spent many hours reviewing the data and sharing concerns with patients before they start therapy. I don't think that anyone should start a medication before they know all the facts that are available. During those years, I have tried to keep my patients up to date, outlining the risks and benefits taking everything from thyroid hormone to estrogen. My duty as a doctor has always been to share the most up-to-date information about the disease and health, as well as ways to prevent and to diagnose and to treat these diseases. One of the greatest concerns of women during their childbearing years and after menopause is the curse of breast cancer. 15% of women will develop breast cancer sometime during their lifetime. By the same token, prostate cancer will result in the deaths of over 30,000 men in 2011. And treatment for both may involve inactivating the testes or the ovaries, resulting in loss of sex drive and sexual dysfunction. Treatment modes have been increasingly effective in lowering death rates from cancer, but now it is time not only to talk about early detection and treatment with the great technical and chemistry tools we now have, but to actually block the triggers that stimulate cancer. There are many studies in women who are still in their childbearing years who may have taken birth controls, and women who have gone through menopause who are faced with the question of whether or not to take estrogen and or progesterone. We know that there are women who have a very high risk of breast cancer as part of their heredity. Fortunately, such family histories are not common. Nevertheless, we also now know that we can identify women who have an enzyme deficiency, one that metabolizes estrogen in a way that puts them at a higher risk. Over the past several months, I have been talking to my patients about Prevennia, a supplement that can prevent cancer. The same findings have been shown regarding the prevention of prostate cancer as well as lymphoma and possibly other cancers as well. This is exciting news to me because for the first time, I am able to make you feel a little bit safer, whether you are taking estrogen or are making it on your own. It is my sincere hope that you will learn all you can about how Prevennia may prevent you and your loved ones from developing one of these dreaded, life-threatening diseases.